to work because we tested everybody before we went back to work and we isolated people, and we do this every month now, or something like that. When are we going to be able to doing a widespread, broad-based surveillance testing and contact tracing for every American?
Yep. So we are, in fact, doing that now. We've had over 10 million tests done. We're at, the public health experts say, as a gauge of whether you have adequate testing for surveillance purposes, you want to be seeing a positivity rate of 10% or below. Nationwide, we're at 9%. 38 of our states are at that 10% or below goal. The others are progressing towards that. So we're going to have 12.9 million tests administered as the projection just the coming weeks, doing 300,000 tests a day. And we're going to be bringing online something, Jake, that I think is quite exciting, which is going to be these antigen tests, which are rapid tests, antigen tests, sort of the look would be more like a pregnancy test, on it's called a lateral flow device. And we are working with manufacturers on approving those. Those are very high volume point of care tests. And so that's going to be also part of the recipe for the future for those kinds of situations, like you rightly say, as a parent, those concerns for our nursing homes, for our prisons, for our meatpacking facilities, to aid us with broad surveillance and testing. So, President Trump has, over the last couple of months, delivered just a historic transformation of testing that's now become one of the models in the world, with the most tests administered of any country in the world. And we're really on the right track here for the future.
Okay, I don't want to belabor the point, but 10 million tests over the course of 3.5 months is not sufficient for 328 million people, and I know you know that it needs to increase. I want to ask about the vaccine because that was a big focus for the administration this week. President Trump, at that same press event in which you were heralding, the administration was heralding the possibility of a vaccine by the end of the year, the president said, quote, "Vaccine or no vaccine, we're back," unquote. For Americans who are listening to the president, can you explain in practical terms what he means when he says we're back? Mm-hmm. I mean, we still need to wear masks. Can we have weddings or large gatherings? Will grandparents be able to visit new grandchildren? How are we back?
Yeah, so what the president was making the point on is everything does not depend on a vaccine. We're committed to delivering a vaccine. We're going to put the full power of the U.S. government and our private sector towards getting to a vaccine. But that's one part of a multifactorial response program. First is the testing that we talked about before. Test symptomatic people, broad surveillance to find cases, surge in to contain. Also therapeutics. We're driving forward on convalescent plasma to be able to treat people. What we'll do then is take hypoimmunoglobulin from that plasma and create concentrated protective immunity for individuals. We've got over 20 monoclonal antibodies that would effectively allow us to replicate in an individual the immune response from somebody who's already recovered from COVID. That, and then if we deliver a vaccine, it's a multifactorial approach here that help us get our lives back to normal, get the disease burden down, and use traditional public health tools so we have our weddings, so we visit our grandparents, so we resume normal life at school, at work, and at life.
Secretary Azar, you were saying that our testing is now the model of the world, but I have to ask, the United States has less than 5% of the world's population, but the United States has also almost 30% of the world's officially reported coronavirus deaths. You said back in January that, quote, "the risk is low. Our job is to work to keep it that way." So did the U.S. government fail? Why is this virus hitting our country so much harder than it's hitting other countries?
So first, just in terms of the actual case counts, we are testing more than other countries or than other major countries, and so we're seeing a tremendous number of cases. Remember, we're actually flushing out significant asymptomatic individuals in the United States. Other countries are not testing asymptomatic individuals in any way like what we're doing. Look, for instance, at Japan, which has a very low case count, but does very little testing on individuals. In fact, I think you have to be several days febrile in order even to get a test there. So that leads to a significant difference. What did the president do here? We defined in January a core strategic objective. I said this very clearly. We cannot hermetically seal off the United States from a virus. This virus will spread. This virus will come here. We said our goal is to delay the curve and to flatten the curve. And that is exactly what we did through the historic border control measures and then through our work working with our healthcare systems and our governors, our heroic frontline healthcare workers, that while the burden has been tragic and terrible, it has remained within our healthcare system's capacity. As the president said, we haven't had any individuals to our knowledge who had to die because they didn't have a ventilator or didn't have an ICU bed. And that's a really important measure of healthcare system resilience. And that's what's enabling us now to do, as we've talked about, move towards reopening and getting back towards a normal state.
I understand that, but we have more, we have almost 90,000 Americans who are now dead because of this. I don't think that this is anything to celebrate, how we handle this as a country.
Jake, you can't celebrate a single death. Every death is a tragedy, but the results could have been vastly, vastly worse. It's also important to remember, Jake, as we face it.
But it's worse for us than it is for anyone else.
No, that's actually not factually correct. When you look at mortality rates, that's simply not correct as a percent of diagnosed cases, Jake. That every death is tragic.
Just looking at the number of dead bodies.
Every death is tragic, but we have maintained our healthcare burden within the capacity of our system to actually deal with it. Unfortunately, the American population is a very diverse and it is a population with significant unhealthy comorbidities that do make many individuals in our communities, in particular African American minority communities, particularly at risk here because of significant underlying disease, health disparities, and disease comorbidities. And that is an unfortunate legacy in our healthcare system that we certainly do need to address. But no, the response here in the United States has been historic to keep this within our healthcare capacity, even in New York City, to keep this within capacity is genuinely a historic result.
I want to give you an opportunity to clear it up because it sounded like you were saying that the reason that there are so many dead Americans is because we're unhealthier than the rest of the world, and I know that's not what you meant.
No, I think that we have a significantly disproportionate burden of comorbidities in the United States: obesity, hypertension, diabetes. These are demonstrated facts that do make us at risk for any type of disease burden.
Sure, of course, but that doesn't mean it's the fault of the American people that our government failed to take adequate steps in February.
Oh no, Jake, please don't distort. No, this is not about fault. It's about simple epidemiology and stating that if we have hypertension, if we have diabetes, we present with greater risk of severe complications from this coronavirus. That's all I was saying, and you know that. This is not, one doesn't blame an individual for their health conditions. That would be absurd. It's simply a statement that we do have greater risk profiles here in the United States, and this is why we've all highlighted the Surgeon General. The president, we've highlighted the special disease burden and risk factors in a lot of our communities that we've got to address.
Yeah, no, of course, no one would dispute that. Let me ask you one last question. There's a lot of disinformation out there, as you know. Last night on cable, someone said that the shutdowns that the states have taken, the governors, are just an effort to hurt President Trump by preventing him from holding rallies. The same person said the day after Election Day, the virus will disappear. I know you know that's not true. What's your response to that?
I just think we need to have balanced, accurate information out there. That's all I and our public health leaders are trying to do, is to present the fact that we're now in a position where we can be reopening. We want to take safe and appropriate measures. The president has laid out very balanced criteria and approaches that he suggests states follow to do that. And that's the path. That's the path forward that we need to take. And I think hyperbolic rhetoric on any side is not appropriate. These aren't partisan issues. This is just health and economic welfare for our citizens.
Exactly. But you would agree that governors did not take these steps to shut down their states because they were trying to hurt President Trump. They were trying to protect the lives of their citizens.
I find that it's better not to try to impugn individuals' motives. The president, the vice president, and I have had superb working relationships with the governors across this country, from whether red state or blue state. We've all been working in partnership to try to help the American people, and we're going to keep doing that.
All right, Secretary Azar, I really appreciate your time today. Thank you so much. And on that nice, nonpartisan note, I will bid you farewell. Thank you so much,
Jake.
sir. Now let's talk about one state that took aggressive steps early on to confront